I move that we accept the consent agenda as presented.
I second.
All right. Tasha has moved that we accept the consent agenda, and Hilda has seconded. Is there any discussion? And Meg, I'm going to be looking at you a lot, so you'll need to wave at me. No? All right, then I will call the vote. Hilda?
Aye.
Tasha?
Aye.
Jonathan?
Aye.
Meg?
Aye.
I also vote aye. Consent agenda approved. Next on the agenda is administration. Superintendent celebration update, review of the Ellensburg School District health and safety requirements and guidelines for the 2021-22 school year. Go ahead,
all right, thank you so much. Let me pull up my, let's see, did it go up? There it is. And let me go. Let's see. Yes. Okay. Current slide. Go on there. Nope, didn't. That's right. Yep, there it is. So as you know, this goes way back pre-COVID when we were first dreaming about what Mount Stewart would look like, our brand new building. And there's Dan Patton, our beloved principal that was at Mount Stewart for a long time. And we were really, at that point, we're all looking at a slideshow of what Mount Stewart would look like. And I was there today, and the excitement of teachers were just ecstatic about the new rooms that they were in. They're excited that they're close to the nature center, and it's just a real celebratory feel inside of Mount Stewart today. And it's just a beautiful facility. As you guys know, we're having our ribbon cutting tomorrow to celebrate that. And so it's just something that we're super excited about. And as you know, Ida, Nace, and Aronica will open in mid-October, and all of our staff and students from Lincoln will be moving into Ida, and they will continue with the remodel there. So just a real thank you to our voters for helping us pass that bond, because without our community support, we would not be able to have that brand new building. I also had the treat today of meeting all of our new certified staff, teachers, and there were a few psychologists. Boy, the energy in the room was amazing. They're excited about teaching. They're excited to be with their students. I shared with them our outcomes that we want for students, that we want them to have strong academic skills and future-ready skills, that we want them to have strong connections and be ready to be a successful citizen, a global citizen in an ever-changing world. And asked them which one of those resonated with them. And that importance of connections just came up over and over again. And they just were great. They shared some personal stories about why they felt so passionate about teaching. So that was really exciting. It got me jazzed for the whole day. Before I talk about our health and safety requirements and guidelines, I want to start by saying, we know from the feedback that we've gotten from our community that people feel different ways about the requirements that we've gotten from the governor and what we have in our plan. What I want to start with is what we all have, I think, in common, is that we're all here for children. We all want to see our students experience academic growth, develop their strengths and future-ready skills. We want them to feel connected to the school and to each other and to staff members. And we certainly want them to graduate to be successful global citizens, not students or young adults that just kind of stand by, but really get actively involved in our government and in the world at the entire world, all of those different issues that are out there, right? We don't want them to be bystanders. We want them to be involved. And then I think the other thing that we all share in common is that desire to feel heard and respected. And as a board, I think it would be good at future meetings to keep talking about what does that look and sound like to feel heard and respected And then I think the other important question that we need to look at and see how we can create these type of opportunities for our community is how do we as a community engage in civil discourse when there's disagreement or conflicts and come together to identify common interests and potential solutions where possible. And I did have a chance to stop at the farmers market with a group that just really had some good questions around the necessity of some of the requirements that came from the governor. And I just appreciated parents' passion for wanting to do what's best for their children. And so within that goal of really wanting to have good civil discourse, we do have a civility policy, and just thought it would be good for us all to touch base on that, we really want to stay within our protocols within our board meeting. And we do have a policy around what that looks like. So just wanted to share that with you guys. And so as we start the ESD health guidelines and requirements, at this time, I'd like to invite Kittitas County Public Health Officer, Dr. Mark Larson, to come up and join us. He's still here. Dr. Larson, thank you for being here. If you could sit next to Director Henderson there, that would be great, so the board can interact with you. So I'm going to see if it'll work here from this link. So our goal with these with these health and guidelines is to keep our kids in school, to keep them in in-person instruction 5 days a week and do whatever we can. What we saw with our data last year is that many students really benefited when we were able to bring them back 5 days a week toward the end of the year. We saw some drastic increase in student achievement and student academic growth. We know some students do well online, and we certainly have a limited opportunity for that this year. But so I'm just super excited. It's disappointing that we weren't able to start. I think we were all hoping that things would, the virus would go down and that we wouldn't have to put all of these same measures in place. But what we do know is that last year, working very closely together with Kittitas Public Health and putting all of those measures that we had in place last year, we were able to stay open from October on when many schools across the state had to close down or didn't even open. We were able to stay open without any outbreaks, and I think our students really benefited from that, and that's what our data showed as well. So let me go ahead. Let's see if this is going to open from here. It didn't change there though, did it? Okay, so let me pull it up a different way here. There it is. 1 second, I will have it. All right, one more click. There we go. Okay, so this is our revised ESD health and safety requirements. These were sent out to all of our parents. Our staff members have had them for a couple of weeks. I sent out a letter to parents about a week and a half ago, right after the governor, as we know, on the 28th, Governor Inslee came out with his directives around what we needed to do, what we're required to do here in the school district, and that came out on the 28th, and that was the same day that I sent this information home to all parents and all staff. And really, it's just a summary of what was in the requirements from the governor. And that included that all staff and students must wear masks while on school buses and when indoors at school, regardless of vaccination status. Masks may be worn while outside, but they're not mandatory when outside. And certainly we are going to make proper protective equipment, PPE, available to all students and staff. We're going to continue those layered mitigation measures within school rules, like promoting of social distancing, antigen testing, ventilation and cleaning. Quarantine protocols, we'll still have those in place. They're slightly different. And we're following the guidelines from the Department of Health, as well as the flow sheet that have been developed by our school nurses in conjunction with Kittitas Public Health. The good news is we're not going to need to do the daily attestations, which I know they were very time consuming. Instead, we're just going to be communicating to our parents and our employees, please don't come to school work. Please don't send your child to sick. If they're sick, don't come to work. If they're sick, please don't send your child to school. And sick being if they have a fever, cough, and there's a whole list of those types of symptoms. And we'll be sending those out again soon to better define what we mean when we say sick. And then we also know on August 18th, and I sent out information to both families and staff members the same day this came out, and that's on August 18th, Governor Inslee announced a new directive that legally requires all K-12 school district employees to get a COVID-19 vaccination, or they can apply for a medical or religious exemption. And we just got the religious exemption form from OSPI recently, and we're working on what that process will be for people here in our district to apply for a medical or religious exemption. And we just put out our survey today, and we got over 200 responses right away around asking people and staff members if they had received their vaccine. And we were pleasantly surprised that well over 200 said that they had received the vaccine and were either allowing our school nurses, there's a database that they can go in and get that information about vaccines. And some of them said, yep, you can have, the nurse has permission to go in and get that information. And other people said that they'd bring their cards to us. So I think we're well on our way to being aligned with what we're being asked to do with the vaccines. So basically, it's pretty similar to last year. The drop-off and pickup plans, every school has their own drop-off and pickup plans, which will be communicated to their families. When boarding the bus, the students must wear a mask and then we try to keep the windows open. We have seating charts on the bus so that if we have to do close contact test tracing, we know where students were on the bus. We're going to still promote the social distancing within classrooms and school buildings. Kelly, do you want to just touch base about the nutrition program for this year?
Sure. So our nutrition program will continue to operate as it has in previous years. One, I guess, positive aspect is this coming year, all students, no matter what your income, will qualify for free lunch. So there will be no fees for lunches. All kids will be able to have a hot lunch at school at no charge. We are still asking, though, that parents complete the free and reduced forms because the Department of Social and Health Services offers a program called PEBT, which is a pandemic emergency fund for folks that need extra support in purchasing food. So if you get your free and reduced form, please make sure that you fill that out and send that in. You can't receive those monies without that form. Let's see, we are still working on the mitigation factors, trying to reduce contact in our lunchrooms. Each one of our buildings has put together a solid plan. Most of our buildings will be using their cafeterias for meals. They will be seeking to keep kids 3 to 6 feet apart, but that's a recommendation. It's not an actual hardcore requirement this year. So we will do our best. We've extended our meal times to try to help minimize cross flow between different groups of kids. And we are going to work hard to get kids outside while it's warm and make sure that they can use either classrooms or large areas instead of the lunchroom. I didn't have an opportunity to visit with our food service director today, but I believe she's operating a hot meal program. I do know, though, that if certain situations occur that we could go back to more of a grab and go situation if we had an issue with COVID or something in our lunchrooms where we needed to do something different. But at this time, with following all of the guidance from the Department of Health around how we handle food, we'll limit the number of contacts with food, but most of the plated food will be plated by our staff and provided to your kids. So that's what I have.
Thank you. We'll continue to encourage students to wash their hands. We have lots of hand sanitizer as well. And students and teachers did a great job reinforcing that last year, and we'll just continue with those routines. Again, encourage students and staff to stay away when they're sick, and really, making it a habit to keep hands away from eyes, nose, and mouth. And we will, again, just take those first 2 weeks to retrain students and what all those different things are that we need to do together as a team to stay healthy and be able to stay in person for school. And we also have a system. We have a district coordinator, Jeff Whitney, as our COVID-19 coordinator, and we have building level coordinators as well that communicate with him. And if staff members need more personal protection equipment, they go to the building level coordinator, and then they communicate with Jeff Whitney. That was the same system we had last year, and it worked really well. We've got a lot of supplies, so we're ready to go. And then we're partnering with a different organization this year to be able to provide the rapid testing. And Kelly, would you like to talk about that?
Sure. So last year we used mostly rapid testing, which is antigen testing for most students. If those students tested positive, then they would be provided a PCR test, or we'd encourage them to get a more comprehensive test. We are going to be working with an organization that is a state-funded nonprofit called Health Commons. This is a health organization that specializes in testing students in schools and working with school systems. They have a program called Learn to Return. It is no cost to anybody. So the schools pay nothing and families and students pay nothing. And we will be following a pretty similar process. If a student is showing symptoms, we will seek out to test. Obviously, there's permissions and pieces that will be coming to you in regards to that. And if we're not going to be doing at this point any universal testing, that could change depending on the situation and how things go. But if there's symptoms, or if students or staff are feeling like they just would like a test, they are welcome to have one, and we will happily have that done. We are seeking, one exciting thing is there is some funding from the Department of Health, and we're seeking to fund a couple extra staff members to help us with some of this testing, because we know that it's going to be intensive. Dr. Larson's here, and he can probably speak to some of this. We have a county, it might be a state policy, but it's at least a county policy called Testing to Stay. Is it? I'm assuming is that a county policy, Dr. Larson?
Thanks. Mark Larson, health officer. So Test to Stay is a program being developed by the state. So the protocol is not in place yet, but the idea behind Test to Stay is really, if we have a classroom that has a couple of kids that are positive in the classroom, we really want to work on keeping kids in class. So the idea is, not every kid in that class is going to be exposed. We look at who potentially would have an exposure that normally would keep them in quarantine for 7 days plus a test, or 14 days, depending, and offering that to parents that they could test their children over the course of a week or so. I would expect that program to be finished this week, and that would keep kids in school. We did do that at Lincoln last year. We had 2 kids in a class that were sitting right next to each other in Lincoln, a 5th grade class. We offered the parents the testing option, and all parents chose the testing option. We had no further spread of COVID in that class.
Excellent. So next week we'll have more information on that, and that will go out to families, and it'll be basically a permission form authorizing us to test any child. And if they test negative, they get to stay. Running Start students, if there's any Running Start students, they are required to follow the rules for Central Washington University, which is the vaccination process that they have for all of their students, and that trumps the Ellensburg School District rules. And again, we just have the Learn to Return program through Health Commons, and that is going to be very efficient for us as we move forward, as they will supply us with all of our supplies for testing, as well as reporting to the state.
Thank you, Kelly. So next, we have a section in our guidelines and requirements around extracurricular activities. Again, requirements provided by our Department of Health. And so there's a link there for more specific information about that. Face coverings. This section basically talks about what an acceptable face covering would be, and certainly some additional recommendations if people are interested in looking at that. Students, staff, again, don't have to wear it outside, but inside are required to wear masks upon entering the building. And students who refuse to follow these requirements, who act in ways that put other students or staff in danger, will be addressed according to the district-wide and building-level behavioral discipline plans and proportionate to the appropriate developmental stage. And staff members who are not able to wear a mask, we have other accommodations for that. Students who receive mask waivers from Kittitas County are grandfathered in from last year. So if a student got a mask waiver last year, they will be grandfathered in again this year. They don't have to reapply for it. And the process, anyone who wants to have a mask waiver for their child, a local physician has to identify a medical reason for the waiver, and then the medical doctor sends that waiver recommendation to Kittitas County Public Health, and Dr. Larson gives that final approval. Cleaning regime's pretty much the same as last year, although now they're saying not to fog the rooms, so we're not doing that anymore. Procedure for working with students. Nurses have their protocol. If we have somebody that goes down to the nurse's office that we think that are presenting with symptoms, then the nurses have their own protocols that they follow for that. And we have a separate space for those students as well. So they're not sitting there with other students. Important for families to know, main communication will be through the ESD updates that with the Samores, the Blackboard, and then some of the schools still use Remind. So those are the primary ways for us to communicate. We will also be keeping track of COVID cases that occur when students are at school in our building, and we're just going to keep track of that on our COVID dashboard this year. And we have training, our Safe Schools training. Some people have already started accessing that. It's training that we do every single year. And there's a section in there on bloodborne pathogens, which isn't what COVID-19 is. It's a respiratory one, but or aerosolized in droplets. But certainly a lot of those same precautions still apply in that case. And there's a special one also on masks and all of the other kind of safety, and that's required every single year. And if staff members who work in high-risk categories like life skills or autism programs, they get this additional training and additional PPE as needed. So that is the overall plan. And before I open it up for questions from the board, Dr. Larson, would you be able to just kind of give us an overview of kind of where we're at in Kittitas County as far as COVID-19 is concerned?
Yes, thank you very much, Board. So as you remember from last year, we talked about incident rates, and our incident rates were pretty high as we went into school last year. I agree. with you, Superintendent, that the schools, the teachers, the parents, the kids did a really good job. We did not have any in-school transmission. We had a lot less kids in school. We had a different variant last year. But that said, it worked really well with local support for school districts. The issue that we have currently is in Washington State, 98% of the variants of the sequenced COVID cases are the Delta variant. Delta variant is much more infectious than we've had before. It does infect kids. Children's Hospital today has 95% of their beds filled, not all with COVID patients. We are currently at 391 cases per 100,000 per 14 days. So that's in the very high transmission rate, as is all of this, all counties in the state of Washington. We currently have 5 COVID-19 patients in the hospital, all unvaccinated. We are seeing breakthrough cases with COVID-19. People that have been vaccinated, they are less sick. So the vaccine is still keeping people out of the hospital, is still keeping people from dying. The hospital is working, as was presented last week by the KVH CEO. They are operating really close to the edge in regards to what they can do from a staffing standpoint. So the hospital is full. Similar to what you were saying about the mandate for vaccination for K through 12, there's also a vaccination mandate for healthcare workers from the governor. And they are struggling through that process just as you are, as is Central Washington University, and as are the state employees. So the people we're seeing at the hospital are sicker, they're younger, but we have less deaths happening currently. And that's a function of probably at least partially a function of people being younger, and also a function of, we know a lot more about COVID-19 disease and how to treat COVID-19 disease now. If you remember last year, we were talking about a shortage of ventilators. It's really rare for us to put somebody on a ventilator these days. We put them prone. There's other medications that we can give in the hospital. But people spend a lot of time in the hospital. We just had a 24-year-old spend 7 days in the hospital at Virginia Mason on the west side. We have a 23-year-old in the hospital here in Ellensburg. So I'm concerned about the fair and the rodeo. I'm concerned about the number of cases that we have currently and the fact that this particular variant is really contagious. Now, on a good point, if you look at what's happened in India and what happened in England with the Delta variant, the rates went up really fast and then they came down really fast. Hospitalizations and deaths tend to follow that later, but we're seeing a little bit of a flattening. So it may be that we're reaching that top point in cases in Washington State, but it's just uncertain at this time. We still have only 49% of people in our county vaccinated for COVID-19. So we're still in a low vaccination rate. And that's part of the reason this particular variant will find people that are not vaccinated. For school-aged kids 12 to 18, which are the only ones that are able to be vaccinated, we have 21% of students in Kittitas County in that age range that are vaccinated for COVID-19, which means we have a whole lot of kids that are still susceptible to getting the disease.
All right, thank you so much. So board members, any questions that you have for me or for Dr. Larson? Or we will tag team it.
Oh, thank you so much for this report. It's very helpful. I have a question regarding communication. Last year, we had like on the webpage of the school, like a COVID-19 access, and then we have all the updates regarding the COVID. Is the same plan for this year, or it's going to be different?
Pretty much the same plan. The only thing that was different is that we're not going to send a letter home every time there is a COVID case in the building. We will be communicating that through the district website on the dashboard. And that was a request that came from administration based on feedback from parents because they felt like they were getting too many blackboards, some from the letters as well as some of the other communication, and just got kind of weary from all of that communication coming from Blackboard.
Dr. Larson, have you reviewed our safety plan, and do you feel that we have mitigations in place to manage the risk?
Yes, I've reviewed the safety plan. You know, the mitigation pieces in place, and we've talked about the Swiss cheese approach to this. You know, if you remove one mitigation strategy, if you remove vaccination, which is the best mitigation strategy, then you have more disease. If you add that, if you add hand washing, you add masks, you add social distancing, we're having a little bit of an issue. I think we'll have a little bit of an issue with that this year because of the 3 foot as needed. It'll be much more difficult to know who's at risk of exposure. That said, I think the nurses have a pretty good handle on those pieces, and I think that with the mitigation strategies in place, that we can expect a good school year. I would not expect, this goes back to the fair and the rodeo happening just before school starts. I think we'll have more disease right early and at the start of school, and then it's gonna go down.
Meg, I'm looking at you just to make sure if you have any questions. Okay, Ford, you can stop me. I have a lot. I know that this entire situation is very frustrating for our community. And I think that this board, it's our role to advocate for the education of our students as best we can. So my questions that I would start off with, will the district be terminating employees who do not get fully vaccinated by the deadline? And if so, will the district be verifying employees are vaccinated?
Yes, as I've shared, we just sent out a survey today, and we are getting a good count of those that are vaccinated. The nurses, with the permission from employees, are able to access a database just for vaccines. That's the only information that's there. And with employees' permission, we are being able to do documentation there just to reduce the workload for employees to have to come in one by one and provide their vaccination cards. We are required to follow the mandates and directives from the governor and OSPI. The good news is that there is, employees are able to apply for religious or medical exemptions. And we just received the religious exemption form, and then we're in the process of putting that procedure in place, and Kim will be communicating that out. And we have not received the OSPI's recommendation for a medical waiver yet. We're still waiting on that. And as soon as we get those, we will be reaching out to employees through the survey that said that they wanted to apply for an exemption, and we'll be getting that information to them.
Okay, I do have questions about the religious exemption and the medical exemption, but I think I want to circle back to the what I was talking about employees. So will terminated employees be entitled to any benefits? And also, when do you expect official statements from the different unions of our district regarding this vaccination mandate?
So all of this information was shared on that same date, August 18th, when the proclamation came out. It was shared with all staff. We've met with EEA. We're in the process of talking with PSE. And, we're through those discussions. They know about it. And, if something comes to us, that we do what we always do, and we sit down and we talk about it, and we try to come to an agreement around things. Any employee that is released from employment does not receive benefits.
Is there not already a teacher, substitute teacher, and bus driver shortage in our district? Oh, I turned myself off. We cannot, this is truly board meeting. We cannot have audience be responding. Thank you. We must keep order.
So right now, fortunately, we have what we need to be able to start our school year. If we started to decrease in bus drivers, for example, then that would cause an issue.
I've asked a lot of questions, board. Do you have other questions? Meg? Okay, I'm going to keep going. Tunji, you were talking about religious exemptions for COVID vaccinations. What is the process for this request? Who reviews it? And how is this process being communicated to employees?
So the process of being able to apply for one, all of our employees know that if they do not want to be vaccinated, they can apply for a religious exemption. We just got that form, 2 days ago from OSPI, so we're developing that process. And once we have that process for how to apply for both a religious exemption and a medical exemption, we will be sharing that out with staff.
And I know I just saw examples, I think, from social work, social services in the state and other areas. And I think, so I don't know, Kim, if you have any more feedback as far as like or Ginger, as far as what that religious exemption is going to be. It looks like it's asking additional questions. It's not just a matter of asking what it sounds like it's asking what your religious affiliation is, correct? And as well as diving a little bit deeper into have you ever been vaccinated prior? And this is based on that. And so I'm interested to see what it will look like for school districts across the state and how far down the rabbit hole they're going on religious exemptions.
So I'd like to address that topic at our next board meeting, because then we'll have the form and we'll have the process and we can go over all of that with you.
Okay, and I would like for the record to say, I don't have the exact numbers, but these things that we're talking about, school opens how soon? And I do feel bad for the administration. This is being put on you by the governor. You are having to constantly shift over and over and over again on all these different mandates that are coming down. It's frustrating as a board member to see that you all have to do this. We need to focus on our children's education instead of all of these new mandates. So anyway, that was probably way too long of a record and I didn't have it quoted, but Matt, if you need, I can write something out for you. Okay. Again, board members, feel free to interrupt me if you have more questions that you would like to ask. I do not need to take the floor all the time. Mark Larson, this is probably a question for you, Dr. Larson. How confident are you with all these measures that we will be able to keep our schools open and in person?
I partially answered that question before, but I'll expand that a little bit. So a lot of that depends on how much disease is coming from outside of the school into the school. So last year, about half of our cases were staff and teachers, and about half of the cases that we had in the county school systems were students. Those, as I said, we didn't have any in-school transmission, so those people came from outside of school. We are having a large event happening the weekend before school starts. So that's gonna, and when we have a low vaccinated county, we will have disease that comes in. Our goal at the county is to keep kids in school. So we will be doing, as we did before, working with the schools and doing case and contact investigation to see who was at risk for exposure. There is pretty strict guidelines in regards to school closures. So just for a classroom, 2 kids in a classroom that aren't related outside, they're not brother and sister, they're not on a soccer team together, that would be considered an outbreak and would cause us to consider closure of that classroom. There's guidelines for closure of schools. We didn't have to do that last year. And we talked a little bit about test to stay. So my goal would be not to close any classes, not to close any schools. It's going to be a lot of work early. I think it'll get better. And that's if we didn't have the current situation that we have with the Delta variant, high numbers in the state, I wouldn't have expected a mask mandate from the governor. That was in response to that. So that's at least protective now as we have these really high numbers. I would expect that to change as we move forward and our numbers come down. I would expect some modification of that mask mandate. So I'm cautiously optimistic that we will get through the first couple of weeks of school. If you look at what happened in some places like in the South, I mean, they had hundreds of cases in schools, and some of those schools chose to start online only because they had so many teachers out. Some schools have closed classrooms. They have a lower vaccination rate in those places than we do, somewhere around 30% in Arkansas and Mississippi, Louisiana, some of those places.
One more question for you, Dr. Larson. So in regard, and of course, Superintendent, if you need to answer this too. So indoor sports, cheerleading compared to theater. So board, we stand for equity. And so help me, Dr. Larson, how are these mandated restrictions different? And in other words, what science is behind these restrictions? So I've looked pretty closely at what cheerleaders can do without masks versus what people in theater can do. And so I was hoping, where's this? If you could speak to the science, and then Ginger, if you have any answers that you can kind of give about where are we moving this? I think when things are based in science, I really hope that they're based in science and it's not just political. And so this is an issue where I see it solely as who has power and where is the politics lying?
Well, I'd have to say you're correct in that regard. So last year, the parents, myself included, with kids in sports were pretty loud voices on the governor's level. So sports got a little bit of special dispensation last year. Bob Lutz, who was the health officer in Spokane, who has a sports medicine fellowship as well. I mean, they developed those sports guidelines last year first, which included testing for wrestlers, testing for water polo, which we don't have, and then moved forward with the other recommendations, as you had said, about cheerleading and those kind of things. I've been working with the state, and there is some equity issues. I've been working closely with the state in regards to theater, band, other things. The science of those things is based upon the third aerosol study that was done, which basically shows that some instruments and some activities have a really likelihood of spreading aerosols. So for example, the oboe is the #2 instrument for spreading aerosols, which I would have not known, although I spent a lot of time with an oboist over the last 20 years. But I spoke with the folks in charge of the fall play and told them that we would be applying rules similar to what we're using for sports to theater, band, those kind of things. I would expect those out in the next couple of weeks, but I told them to go ahead and buy Clue and start working on the set pieces that they need to do that, and those kids will not have to be wearing masks when they're doing those. Singing is probably the most problematic of those things, but I would expect those guidelines to come out pretty soon, within the next couple of weeks. But you're right, they need to be one of the problems we've had with COVID, well, there's been a lot, but one of them has been inconsistency in guidelines and changing guidelines. And that's partially it's because the virus is changing. Partially it's because initially, it was a new virus. We didn't really know. We initially looked at droplet as the biggest problem. Now we know aerosols are a much bigger problem, but we're trying to make those guidelines consistent. So kids that are doing theater and band should have the same opportunities to do those things as somebody who's playing football.
Yep. All right, board, any other questions? I've got one more.
Go ahead.
All right.
I just want to do a quick say it is because of our local guidance and close work with Kittitas Public Health that we appreciate the advocacy that you do on that and calling out those inconsistencies and widening opportunity for our students in a safe way. And we would not necessarily be able to do that without partnership from you. So the school appreciates that.
Thank you. I am from here. Both my kids went through the Ellensburg School District.
Yes, thank you, Dr. Larson. My last question, and I don't have it scripted, this is bad, but it really comes down to, I think, some individuals that I recently spoke with. And I think, so Dr. Larson, if you can help me understand, as our governor has declared, this is an emergency, and so that therefore he's making these mandates. If we are in a pandemic, can you help me understand as a health authority as to why we would be threatening to terminate healthcare providers who have consistently for a year and a half served our COVID patients pretty consistently and have taken all of the precautions to not spread it, but yet we're going to do that. We're just going to let them go.
Yeah, I'll try to dive into that. And that actually goes along with what you were asking about teachers. Teachers did the same thing last year. Teachers were on the front lines. They spent time with kids. They worked hard. So that gets back to mandates in general and vaccine mandates specifically. I want to clarify a few things. So we can make recommendations. The next step is we make a directive. So I could say, I recommend that you wear a mask in school. That's just me saying, I think it's a good idea. A directive is a little bit stronger. A mandate, which the governor is doing, has the same effect as law. It's not a law, but under the governor's emergency authorization, it falls under the same thing. So the governor has some mandates. From a public health perspective, mandates have been used in regards to vaccines for a long time, right? So measles, mumps, rubella vaccine, pertussis, those kind of things. We have mandated vaccines for school children. In regards to COVID-19, I mean, the first step was to get voluntary buy-in to getting vaccinated. You have somebody who's an early adopter like me, who's a healthcare provider. There are healthcare providers that are not early adopters. That's what you're talking about. So you have some early adopters, and then there were early adopters in nursing homes, the elderly. Our population vaccinated older than 65 is almost 80%. So in our county. Then you get to some giveaways, essentially. So then we try to convince people to get vaccinated by giveaways, things like $100 gift cards. We had those for a while. And encouraging people to get vaccinated. So there's just a vaccine mandate for the Gorge, where they said, if you want to come to a Gorge concert, you need to be vaccinated or have a negative COVID test. Those things are encouragements to people to get vaccinated. And then the last step really is mandates for vaccination. So our numbers are low. We have a really high transmission rate currently. Hospitals are full, and the governor has really taken a strong step in our state, whether you agree with it or not, to reduce deaths. So the mandates come because the governor feels like that's the next step. We and I'm just going to talk about myself in healthcare. We in healthcare did not all get vaccinated. So there's opportunities for people to have the same waivers, as in K through 12 education. We can choose to have a medical waiver. We can choose to have a religious waiver, but there are consequences of those behaviors. So I've been on calls with the hospital. People at the hospital that choose to have a waiver will have to wear an N95 mask. They'll have to be tested on a regular basis. I mean, there are some accommodations that will be made for those people to reduce disease transmission. But we will lose some people because people feel very strongly, and I think we need to do a better job of listening to those reasons. Why people feel strongly about it. But the governor felt strongly that we were in a situation where he had to mandate it. So it's not just healthcare, it's not just K through 12 education, it's post-secondary education, it's everybody who works in state businesses, and it's going to be pretty rocky for a while because people are going to struggle with what you just brought up.
Dr. Larson, I actually have a question too that came to me, and I was speaking with some folks recently, and that was around the vaccines. And could you talk about when someone goes in to get a COVID-19 vaccine, what should routinely be reviewed with them before they get the vaccine as far as like side effects? Like what's that process? So it's a concern.
Yeah, so currently most of the vaccines that are being given in the county are either being given at pharmacist's office or they're being given in physicians' offices. We've stopped the big mass vaccination clinics that we did. But during the time we were doing mass vaccination clinics, people would be given information, they'd have a consent form signed. There were physicians there at the fairgrounds. I volunteered there multiple times, and we had people that would have more questions. And one of us, a nurse, a physician, a PA, a dentist, would come up and talk to those people about their concerns and answer those questions. Then they would sign. After reading a consent form, they would sign the consent form. Here are the risks, here are the benefits. Most of the people that came in already had read that information and already had their minds made up, but now that we're mandating it, that's probably a more important piece. And I probably need to make sure that I'm talking to the pharmacies that are giving vaccinations here in Kittitas County and make sure that they are adequately informing people of risks and benefits.
Thanks. Thank you.
Thank you.
Thank you, Mark Larson, Dr. Larson, and thank you, Ginger. Board, Meg, any other questions? Or Mark, Dr. Larson, go ahead.
I just have one more thing to ask. So there is a waiver form for masking. We used it last year, as Ginger had pointed out. We had about 35 mask waivers in the whole county last year. Almost all of those were for severe autism. There were a few others. Those people also get some kind of accommodation. So the folks with severe autism, we did more testing with those teachers last year because the teachers were at risk. We weren't testing the kids. If somebody couldn't wear a mask, we had them wear a face shield and a drape. We still have to do source control. So it's not, we get a waiver for wearing a mask, but it's not a waiver from keeping other people safe. So there is a form. The school district has the form. If parents want the form has to be taken to their healthcare provider, an MD, a DO, a PA, or a nurse practitioner. That physician needs to sign that form with a diagnosis, and then that form comes back to me at public health. Sometimes we route it through the school nurses to see what kind of accommodations are available, and then that particular form then comes to the school nurse at Lincoln or at Valley View or those kind of things. So there's a process. So for parents who are interested in a mask waiver, they should receive that form from the school district first and make an appointment with their physician's office.
All right, thank you. So board, we will move to the next agenda item. Right. And so, Matt, I'm looking online, just point of clarification. I know that we have moved from our study session. We have asked to move public comment to now, so that way we can speak specifically to the superintendent's update and the review of the ESD health and safety requirements. So are you able to go ahead and get us set up for public comment? Okay, I'm going to get my script here. So again, those of you individuals wishing to tonight, we are taking public comment specifically and only to the superintendent's update. So the review of the ESD health and safety requirements and guidelines. Individuals wishing to be heard by the board will add their names to the document in the Zoom chat box, or individuals will recognize within Zoom by using their icon or emoji. Or by raising their hand. Also, Matt, you have a sign-in sheet, if that's correct, for those here individually. Individuals will proceed to make comments within a 2-minute time limit. In order to provide equal opportunity for comments, an individual's microphone, or I will ask you to stop speaking, will be turned off in 2 minutes. Public comment will be available for 45 minutes. The chair may interrupt or terminate an individual's statement when it is too lengthy, personally directed, abusive, obscene, or irrelevant. The board as a whole has the final decision in determining the appropriateness of such comments. Sorry, my screen went blank and I had to get it to come back, and it didn't come back in the same spot. The board as a whole has the final decision in determining the appropriateness of such rulings. In accordance to the Open Meetings Act 4230, agendas and topics must be set in advance of the meeting. Board members will not respond to public comment during the meeting. Additional comments may be submitted to the board at board@esd401.org. Matt, are you ready to open public comment?
Yes.
Sorry, I can't take any questions, but let me see if I can clarify something. Matt, are you ready to open up public comment? So I think what we need to do is try to take it as equitably as we can. So we would want to probably bounce back and forth, however that would do, however you can manage it. We do not want to limit the public comment in any way. And we want to make sure those that are here as well as online both have equal opportunity to speak. So I'll let you decide how you manage that. To do one or the other. Can you, okay, then how about this, Matt? We do 5 and then we do 5. Would that work? Okay, perfect. All right, so let's start off with in person. We'll take the first 5. Matt, you'll call those names up, correct?
First one's Heather Spillane.
And again, everyone making public comment, please state your name and address for the record, as well as be mindful that you have 2 minutes. Matt, are we ready? And Matt will be setting a timer for the screen so that you can see that.
Good evening. My name is Heather St. Hilaire of 910 East Spokane Avenue in Ellensburg, and I've come to speak out for my right as a parent to choose what's best for our family. My husband Keith and I moved here with 4 girls because we heard it was a tight-knit small town community, and we love being on this side of the mountains, away from the highly politicized scene of the West Side. Due to the unnecessary social and emotional content that is infiltrating Washington State schools, we adopted to homeschool in the fall of 2020, and we will continue to do so until the union decides to make changes to the curriculum to reflect a parent's right to choose what our kids are taught about gender, race, sexual orientation, and most recently, masks. I have personally researched a wide variety of viewpoints on masking in particular, and due to the uncertain efficacy of masks, paired with the emotional and mental toll that widespread masking has on children in particular, I urge the board to give parents the option to mask or not mask our children. Masks have not been shown to be particularly effective at preventing the spread of COVID, but let's just say I agreed with a small percentage of efficacy. A study from the Oxford Clinical Infectious Diseases Department said, quote, single-use medical masks are preferable to cloth masks for which there is no evidence of protection and which might facilitate transmission of pathogens when used repeatedly without adequate sterilization, end quote. Are students being given single-use medical masks throughout the day? Who is monitoring the use of masks? What is being done to ensure proper sterilization of cloth masks? Are you, as a board, checking in to make sure teachers are monitoring every student all day for proper masking etiquette? Of course not. And as a parent, I wouldn't expect this, because if I send my kids to a school, I am entrusting you with my most prized possessions. And I recognize that takes an amount of faith in the system. Right now, my concern is that that system is broken, and I don't feel comfortable sending my kids into that environment where teachers are afraid of students and students are taught to fear others getting too close.
Thank you. Who's the next person?
My name is Renee Kraus. My address is 413 North Main Street. I have one junior in high school. Excuse me, I'm trying not to get emotional. I wanted to read a quote. I actually had quite a bit written out, and I unfortunately lost it on my fantastic computer, but I'll keep it short. This is a quote. If you want to know the true characteristic of a human being, give them a position of unbridled power. I read that quote because I would like to know who has such unbridled power over our lives and our children and the decisions that we make for our children, besides us, besides even our children. Because I have a high schooler, he's quite capable of making his own decisions, even in health regards. I've raised him to know that he is capable of making solid decisions. So I also look at Dr. Larson and wonder, how do you have such unbridled power that you put yourself in a position, or somebody puts you in a position, to review our child's health record if you stoop to the level of feeling you need to have a waiver to excuse your child from wearing a mask? Because I have a healthy child and the mask didn't work. It's mentally straining. So you take a waiver and you put it in your position, and who are you to say from their local doctor that you know better what's best for them than what they know? That's just one example. Thank you.
Thank you, Matt. Next person.
My name is Melissa Eggers, 505 West Helena, Ellensburg. I'm a lifelong resident of Kittitas County. I'm also a licensed massage therapist and retired midwife. But more important, I'm a grandmother of 7 children who live in the school district. My grandchildren dislike wearing masks all day. They've experienced everything from face rashes to headaches to anxiety and learning difficulties. Many of them experienced fear of bullying or getting into trouble if their mask was not covering their nose. They felt isolated and insecure about who they could or couldn't play with, which line was appropriate to stand in, and if they were too close to other children. My grandson took a picture of a teacher using a tape measure to measure the distance between students while they ate lunch. What's next? Ankle monitors on kids, as was done to a student in Eatonville recently. My grandchildren don't look forward to returning to school, and most of them won't be returning. A recent study from the CDC of more than 90,000 elementary students showed there is no scientific rationale for forcibly masking school children. There was no significant difference between those schools where students and staff wore masks and those schools where masks were optional. The American Academy of Pediatrics states that for masks to be effective, they should fit snugly without gaps. They also advise people to wash your hands or use hand sanitizer after touching your mask. How many kids or adults do this? Furthermore, by requiring children to wear masks, you're promoting the idea that masks can prevent or treat a disease, which is an illegal deceptive practice. And last, did you know that Washington Department of Education school discipline laws and regulations regarding the use of force on children states that interfering with a child's breathing is presumed unreasonable and is prohibited. Forced mask wearing is child abuse. It can reduce oxygen up to 20%. No child should have to break a rule to protect their well-being. I urge school board members and teachers to advise parents and children that they have a right to refuse to wear a mask or not.
Thank you. And that's your 2 minutes. Thank you. Matt, next person.
So this is a very different topic. I know it's contentious, but I expect that I am speaking for many other parents when bringing this issue to your attention. I could talk probably for hours about all the terrible things this country has done, and I actually want my children to learn about all of that. But I also want them to learn about all the great and noble things this country has done, because only by learning a balanced view of history will they know what to avoid and what is worth holding on to. I wish I could trust this school district to teach just that, but I cannot ignore the numerous voices calling for radical changes in our public school system. The education some in this country want to push on our children will undeniably harm them, all in the name of social justice and equity. I don't deny that there is a lot of room for improvement in our public school system, and I am all for making changes that actually improve the learning environments for children of all backgrounds and ethnicities. And I take the issue of racism very seriously. My wife being Japanese and being yelled at by, passing cars has, given her anxiety. But I will not have my children taught that their father is hopelessly racist while their mother is a victim of oppression in America simply because she's Japanese. My eldest will start kindergarten in 2022, and I will not allow my children to be exposed to this extremely destructive and harmful lie while at school. And I certainly hope that you won't either. For now, they are only training school boards in superintendents and district faculty, but it would be foolish not to expect further efforts to force this ideology to be taught in schools. And I speak for many parents here when I implore all of you to keep a watchful eye out for those efforts. Please help us to protect our children from radical ideologies that absolutely have no place in our community.
It's time. Thank you. So Matt, who is the next person? Are we? Okay. And I do want to put out the reminder that, again, this session is for the health and safety requirements, the review of that. So again, make sure that you tie that, your public comment to that. Thank you.
I will absolutely keep my comment to that. First, I want to say, Dr. Larson, in December, my dad and my husband were both in the hospital, nearly dying of COVID. And you recognized my family's name and gave my mom a call and let her know that you care. And so I want you to know that I appreciate the work that you do. And you also were very valuable to my family when I have a niece, and actually 2 nieces with a traumatic birth. And one of them is profoundly autistic. And one of the reasons why that family enjoyed working with you is because you respected that they needed to sometimes make different medical choices, and that they were exploring things and trying to figure out whether what was typical is what would fit for them. And so with that, I just can't believe that you don't actually struggle with some of what's happening with the forced vaccination while we're still gathering data about vaccines, and how we're now bringing down something quite profound and impacting people's lives over something that's still being studied. And I am going to assume that you are a person with good intent, because that has always been my experience of you. And so I'm hoping that you will be able to speak to that and advocate for people who, I find it troubling if we have to move to religious like calling out a religious thing and then having our lives explored to decide that on something that's actually philosophical and science-based, and that should be part of our medical freedom, should be part of teachers' medical freedom, should be part of healthcare workers' medical freedom. To speak specifically to the adoption, I'm going to lose, but the fact that we're testing students and only going to bring down consequences for the unvaccinated versus vaccinated, when we know that even if you're vaccinated, you can spread and get COVID, seems inconsistent and illogical to me. So I'm hoping we could address that in the guidelines.
Thank you. All right, Matt.
Remind the people online that if you're interested in public speaking,
Yes, so those of you on Zoom, if you did not hear, we do need you to raise your hand. Make sure that you use the emoji that shows that you're raising your hand so that way we can call on you for public comment. Okay. All right,
Can you hear me?
yes, go ahead.
Hi, my name is Erin Zamzo, and I live at 1051 McCullough Road in Ellensburg, and my son goes to Ellensburg High School. And I just want to express my gratitude to the school board and to Dr. Larson for working to keep the kids safe and to reopen or to open in-person classes. My son is a senior, and I really hope that people can look objectively and look at the science and understand that us all working together to keep each other safe is so important for our kids and for people who legitimately should not be immunized because of some medical condition. So I appreciate your work. I appreciate the mask mandate. I don't think we ever should have stopped masking personally. I never did, but it seemed like you are not hearing from a lot of the parents and people that I personally know and talk to all the time that are very supportive of the precautions, vaccination when possible, masking, and doing everything we can to keep each other safe. So thank you for that.
Thank you. Matt, do we have another person from Zoom? Okay. All right, as you're looking to see that, do we have the name of the next in-person person that can come up to the microphone?
Yes, Jamie.
Okay. All right, Jamie, as soon as he gets the timer, you're welcome to begin.
Okay, I'll just start now.
Okay.
I have a lot to say. Jamie Youngquist, 1915 North Water Street. I came back to Ellensburg in 2005. I grew up here, born and raised, and I was excited to raise my kids in a small, tight-knit community where I knew that we would look out for each other's best interests and overall well-being, because that's how I grew up. The overall well-being and what is best for our kids has always been the MO in our community. And today, unfortunately, that has drastically changed. To follow a governor's mandate and take away my ability to make health-related decisions for my own children goes against everything the Ellensburg School District has ever stood for, what is best for our kids. I come to you today and strongly encourage you to look at what is going on around us and what is coming down from the governor, and honestly ask yourselves, Are these mandates really what's best for our kids? In the letter you just released, you stated that student success and identifying students' needs are top priorities, along with promoting safety for both staff and students when starting school for the 2021-22 school year. That was your opening sentence. So I ask you today, if identifying students' needs and promoting safety are your top priority, then why are you following a governor's mask mandate, which only addresses one virus and clearly ignores the alarming rise in childhood anxiety, depression, obesity, suicide rates, drug addiction and overdose, and domestic violence all across our state, all of which have increased since school shutdowns and mask mandates? Ask yourselves, is masking our kids really promoting the safety of our students and showing them that they are a top priority? I think not. As a former high school teacher, I've been forced to look at health ramifications of masking our children. I could go on and on about how masks impede breathing, which can trigger a variety of other health problems, including anxiety and the inability to focus. I can talk about how masks do not function correctly after 20 minutes of saturations. Our students sit there and suck on them, which not only destroys the very function of the mask, it creates a perfect breeding ground for bacteria and detrimental virus reservoir. It's disgusting. Masks also impede on facial expression and visible lip movement.
Sorry, time. Sorry, next person, please. I'm sorry, I totally lost track of time. Okay.
Well, good evening. I appreciate you taking time to have this session tonight. And as I'm watching, this isn't so much a comment as it is a question. And I think Dr. Larson can address this, and hopefully the school board and maybe the superintendent as well. If we are so concerned about starting school after this potentially super spreader event of the fair and rodeo, was there not any consideration of backing up school a little bit, maybe for 2 weeks, in order to ensure the health and safety of not only our students, but our staff and other members of the school as well?
Thank you. All right, Matt, do we have another person from comment?
Yes, Kayla Carlson.
Hi, Kayla Carlson, 491 Trinity Lane, Ellensburg. I am also a lifelong resident of this county. Jason, I'd like to thank you for taking time to meet with a few parents outside of here and addressing some questions that we had to the board, since we are not allowed to ask questions. That was very gracious of you. Ginger, you made some comments earlier about our children and their learning ability and being able to express themselves and learn expression. How do they do that? Because I can't see one expression out of any of you up there, let alone understand you properly. There are children that need help with speech, that need to see their teacher's face to learn how to speak properly. You're impeding that. And if our children's health and well-being and education is a top priority, I don't believe you. I also have a son who is wrestling. Why is he allowed to wrestle? They touch each other, they're in each other's face. Why is that okay? But he can't sit in a social distance classroom without his face being covered. Because as I understand it, this year, they don't have to wrestle with a mask on. So how is that any different? We can go to a restaurant and sit next to people that are right behind us without a mask covering our face. None of it makes sense. And I implore every one of you to start asking those questions and protecting our kids and our right as a parent to choose, because you're not doing that.
Thank you. Matt, the next person. And just as a reminder to make sure that your comments are not personally directed.
Amber Law. Baker? Thank you.
Feel that I'm nervous. My name is Amber Baker, mother of three. I'm also born and raised in Ellensburg, graduated from Ellensburg High School. The superintendent and the school board have decided that our kids should go to school masked. I have listened to your reasoning for over a year and noticed that it's missing a few things, mainly evidence, data, common sense, and basic human decency. You have presented no facts at all, so let me do that now. COVID poses almost no risk to our kids. 4.2 million kids have tested positive for COVID. A total of 0.008% of them have died. What about the flu? The CDC estimates that 480 kids died from the flu in the 2018/2019 season. That's more than have died from COVID in a year and a half. Did anyone on the board suggest that year that kids wear masks for the flu? A flu that is again more dangerous than COVID. Do you know what it's called when you force your kid to wear a mask for a disease that poses almost no threat to them? It's called child abuse. If you want to look up a disease, look up Munchausen by proxy, because that is what this is. Do you know what kind of psychological damage we do to children by forcing them to cover their faces? Teaching them that the air is toxic, that everyone around them is sick. Have you ever wondered about the health effects of forcing kids to breathe through sweat and spit and dirt-soaked rags every day? What about learning to read and they can't see the teacher enunciating the words? What does it do to a kid's developing immune system to have to wear a mask all day, every day? You are satisfied to place this burden on children anyways, and why? It's not to keep them safe, they are safe. It's not to keep the adults safe, they can get vaccinated if they choose to. No, you do it to make yourselves feel better and to protect yourselves politically. The child's mask is a symbolic security blanket for you, not them. It's a disgrace and you should be ashamed of yourself.
Thank you. Matt, do you have another person?
Michelle Sharp?
My name is Michelle Shook. I live at 5261 Cove Road. I am a born and raised Ellensburg local, and I'm a mother of two value students. I came to the meeting tonight to voice my opinion regarding the requirement of muzzling my children during the 21-22 school year. I realized that things have changed and evolved in Ellensburg since I was in school, but never once did the school require a mask during any of the flu outbreaks. The facts that have been previously pointed out regarding the flu and COVID statistics don't support the current decision of our local board. I can understand the rock and hard place that the board has been put in, but I'm not interested in taking orders from the board, the governor, or Dr. Larson, none of which know anything regarding my child's health history. As their mother and legal guardian, I reserve the right to decline the invitation for participation in wearing a mask. I'm asking for the support and understanding from our local, and I repeat, local board, that we need to band together and understand that wearing a mask is not a one-size-fits-all option.
Thank you. Matt, next person.
Danae Skistad. I live on Cove Road. And I just have a quick question. I didn't prepare anything for tonight, but Dr. Larson, you said, I think it was like 30 some kids that were allowed to go without a mask last year. And I'm just curious if any of those were related to an outbreak. I think that's an interesting number. And I'd like to know what that is. That's it.
Thank you.
Mm-hmm.
How are we doing, Matt? Okay. Kevin Mullen, as soon as you're unmuted, go ahead.
Can you hear me okay?
Yes.
I'm Kevin Mullen. I live on Water Street and I have two children in the school district. One is in starting middle school right now and one is in elementary. I would like to speak out and say that I fully support everything that the school district and board is doing to keep our kids safe. As a kid, as an adult who has a father who is terminally ill, who needs protection, these kind of extra steps, and that's all they are extra steps to possibly help everything. And I think one thing that people keep misunderstanding is that the local school board or anyone in the district, Dr. Larson or anyone, has any control over whether or not they get to ignore the governor's mandate, unless someone personally has millions of dollars that they can possibly come in and fund everything. If the governor actually cuts out the funding for it, which is a thing that I believe can happen, then if you don't like what's happening, and I'm not trying to sound callous with it, you may either move, you may either keep your kids at home, or do everything you can safely, soundly, and just think of other people and know that you have the right to say your opinion, but other people also have the right to not agree with yours. Thank you.
Thank you, Matt. Any more?
Chad Youngquist.
Okay.
Chad Youngquist, 1915 North Water Street. I had about an 8-minute message here, and looks like I'm just going to have to skip to the punchline. So we've heard from both sides tonight, and we're 18 months into this mess, and everyone in this room and everyone on the Zoom meeting at this point have taken a side, and that's just what has happened. Everybody has taken sides, and the further we get into this mess, the wider the chasm gets between the ideals. And what we're seeing is we're operating under a governor's mandate that's way off at one end of this spectrum. And it doesn't allow for any conversation or any compromise. That's no way to move through this thing. We have to come together and somehow push this community and this state and this country in a positive direction. The only way we're going to do this is through compromise. We've got to make some incredibly brave decisions. You, Dr. Larson, you, school board, we've got to make the brave decisions to come back off of the governor's mandate and find a way to come together as a community to compromise, to figure out a way to work through this where everybody wins. I'm sure everyone in this room that is anti-mask would be happy to come up with a program or some different system to allow their kids to not wear a mask and somehow make things work. We're not anti-mask in the sense that if you want to let your child come to school with a mask, or you want that for your child, that's fine. We just want to be able to have the freedom to make our own health decisions for our own children. So in this mess and in this hard line on one end of the spectrum, we've got to come away from that and walk the line of compromise and come together and unify in a way that everybody's voice is heard and it works for everyone. Thanks.
Thank you. All right. Megan, as soon as you are unmuted, you may go ahead.
Thank you. Megan McConnell, 404 South Maple Street, parent to an Ellensburg High School student. I, first off, and most importantly, simply want to express my gratitude and thanks to Dr. Mark Larson for his dedicated service to this community. I cannot imagine the stressful situation that this divided community has put on him and his family, and I just mostly want to thank him for that. I humbly want to acknowledge the scientific experts. I am not a scientific expert, but when I look at the experts that exist in the CDC, my friends who are doctors, people that I know and recognize that we need to follow public health expertise. I ask my fellow community members, if this is a public health threat, if there was a national security threat, what sacrifices would you make? If there were bombing threats, would you turn your lights off even though it infringed on your ability to live life as you wanted? Would you restrict access? Would you, take a ration card and reduce the amount of butter or sugar that you ate? Would you go months saving up sugar so that you could bake a birthday cake for your child? Because that's what people have done before when the security of our nation is threatened. And this is a different kind of threat, but we all have to recognize that we live in a community together and that our individual freedoms are sometimes sacrificed for the public good. Thank you.
Thank you, Megan. Okay.
also on first comment list.
I'll do it. Okay.
Pretty top forward, then when you're done, please put your name on the sheet.
Yes, we'll do it. Okay.
So I'm Nicole Cassidy, 711 South Cypress Court, Ellensburg. A lot of people have pointed out many reasons why the masks are unhealthy for our children. So thank you. I am not gonna do my 3 minutes on that because so many have pointed out very good points. I just want to say that I actually really have a question. If they're pushing this hard on vaccines for the school and the staffing, are they going to push this hard on our children? Because that's the next step, and that is absolutely unacceptable. Between the masking and the vaccines, this is a country of freedom. We should have the right as parents, and we should have the right to make the choices. I understand people are fearful and they have immune compromise and everything, but I think that either way, we need to come together and it should always be a choice. We live in a country that we are blessed to always have a choice, and yet we are not given this. I am fine if you want to send your children, if you want to get vaccinated, if you want to send your children with masks, I have no judgment. Go for it. That is what's best for you and your family, but that is not what's best for mine, and it should never be forced on anybody. And I want to point out that we need to be here for our children because we are our children's voices. And we also need to help our staff because our staff should not be pushed on this either. This is unacceptable at all. Nothing that's happening is acceptable. To be mandating anything like, sorry, I had a list. I just can't wrap my head around this, honestly. I just don't. I feel like all these rights are being taken from us as parents. All these rights are being taken from us as adults. We should not have to make a choice and have it forced upon us as parents or adults on vaccination or masking. And that's just how I feel.
Thank you. So Matt, you have looked through Zoom, correct? And we have no other hands up in Zoom. It looks like I've got at least 2 hands behind you. Where are we on time? Okay, perfect. So the 2 hands, the gentleman in the first, bro, I saw you first.
My name is Gary Land. I live on 405 West Illinois. I didn't have anything planned. I thought it was a Zoom meeting, but I'm a concerned parent. I see what's going on, and it doesn't make sense. These mask mandates seem ridiculous because I can go online and I can see our politicians who claim to be about mask mandates, and yet you see video of them in a huge group with no mask on. And then when the camera comes on, they put a mask on. Over the weekend, Nancy Pelosi had a huge gathering of people. No one was wearing a mask. She wasn't wearing a mask. All the servers were making a mask. For me, the problem is the hypocritical, do what I say, but not as I do. It's ridiculous. And then with the vaccine, how can you guys mandate that when it's still in trial phase? How is it that you guys are mandating it and yet the pharmaceutical companies aren't liable if you get injured from it? It's ridiculous. Why are we doing this? Why? Why can't we have informed consent? Why can't we have the choice? It's my body, my choice. Why is it now seem that it's my body, your choice? It's ridiculous. I will not do this. Our constitutional rights aren't suspended from a pandemic or supposedly, which is crazy because the death rate from 2020 is about on par with what was in 2019. So if this is such a deadly pandemic, why aren't the death rates showing? It's just crazy.
Thank you. And I believe the individual in the back, if you can also make sure that we have you sign in. So if you did speak, if you'd sign in. And I think there was another person that signed in, right? Thank you. Okay. And I did see a hand over here. So I think it might have been the gentleman with the hat. If you are wanting to speak next, I just ask that you go check in so we can make sure we get you in here with the time limit. And if you're ready, go ahead.
All right. My name is Melissa Reynolds. I live on Skyline Drive. I want to address the mask exemption because I have an autistic child who her doctor signed off on this exemption because it's for her best interest. And Dr. Larson wants her to wear a shield and a bib. Are you freaking kidding me? She already has enough issues in school. You want her to stand out more? How is this okay for our children? You should be ashamed of yourselves.
We do need to maintain order. So of course, go ahead, but everyone else, please.
You keep saying this is for the best for our children. You want education for our children. How many kids really failed last year on their ingenuity, but got the free pass, which is, I get that, but that's not what's best for them. Not being able to breathe is not what is best for our children. You all should be ashamed of yourselves. The governor does not know my child. Dr. Larson does not know my child. These teachers barely know my child. They do not know what is best for my child, but I do. I do. None of you do.
Thank you. I know we have one more person, and I think that's it on oh, and one more on Zoom. So I am going to ask that these be the last two. That'll put us over time, but that'll sneak it us in. So go ahead, sir, when you're ready.
Justin Williams, Ellensburg. So teachers, state workers, firemen, police officers, October 18th, they have to be vaccinated or terminated. Our Ellensburg School District is willing to be shorthanded on teachers, firemen, city firemen, police officers, all these people. This is Ellensburg. You help your neighbor out. It's a small community. You guys are willing to let our teachers go who teach our kids over a vaccine. Dr. Larson said that they could get tested, they could wear a mask, they could live in a bubble, whatever. But you are willing to let your neighbor go, lose their job over this. Where's our community? Where do we stand together? Shame on Ellensburg School District. That's a horrible thing for somebody to lose their job over their right to not choose a vaccine.
Thank you. And I believe our last public comment is coming from Zoom. And sir, if you could sign in, thank you.
Hello, thank you. My name is Lindsay Montgomery. I live on 60 Valley View Drive. My son is attending Morgan Middle School this fall. All of us have the same common goal on this meeting, and that is our children. We need unity. And unfortunately, COVID-19 has created complete division in our entire country and in our world for that matter. I ask for the best judgment of our children be put in the hands of the parents and the guardians and not in the government's hands. Our children are our top priority and should remain that. They are the future of this country. They are our future. They are our livelihood. They are our legacy. And that is how they should be treated. They shouldn't be forced situations that go against what we believe in as a community and as parents. And I just ask that the judgment be put back in the hands of parents and not in the hands of government, making a universal decision for all children when they are not looking at what is truly happening in each of these homes. Thank you.
Thank you. And with that, public comment is now closed. Hold on. Okay, so now that public comment is closed, I would like to give the opportunity for Dr. Larson or the superintendent for any clarification. So most of you have looked at the governor's mandate. So on the list today was a discussion of letter to the governor. So currently we have no local control, right? So that's the issue with where we're at with mandates in regards to vaccination, mandates in regards to masking. We have no local control. We had local control last year, and the school districts worked really, really hard to keep kids safe. Parents worked hard, teachers worked hard. To have that local control back again, the governor has to give up central control. Public health in Washington state is home rule public health. I've lived here for 23 years. It's my community too. I am a local public health officer. That's where the power should be in regards to making decisions. It has been in Washington state as long as public health has been around. So the pressure should really be on the governor's office. It should not be on teachers. It should not be on school boards. It should not be on local public health, because the ability to change that is not in our wheelhouse. I address these issues on the governor's level all the time, every single day for our community. And so what I would ask parents is to address things towards the governor's office, because if we have a mandate from the governor to wear a mask, local control does not allow us to say we don't have a mandate. So if we can get the governor to change that, then it's not that we don't have any control, it's we have local control. So then we can make it so what happened last year, which was a situation where we had no spread in schools, would happen again. So.
Write a letter for us.
Sorry, we cannot comment to that. Sorry, I have to maintain, sorry.
We just need your help. Write a letter saying it should be a choice.
So,
for us. We sent millions of emails.
all right, so I'm going to have to put in a recess. So I think if that's what it takes, I'll have to ask everyone to leave and we'll have to clear out. So I have to have control. This is your last warning on that. If we can't have warning, then I'll just have to do the recess. I don't want to do this. I think I can speak for the board to say your comments are so critical. We do want to hear from our community. It's very important that we hear from you, but we also have to keep order, and we have to keep to our agenda. And I am held to that, and so I will stay to that. Superintendent, did you have any clarification?
Yes, I would just add to what Dr. Larson said. These are our legislators, Senator Judy Warnick, Representative Tom Dent, and Representative Alex Ibarra. If you haven't written them, if you haven't contacted them, these are the people that are in Olympia. These are the people that are working with the governor all the time. I would suggest that you reach out to them and direct some of your letters and your requests there, because they are the ones that can really put that pressure on and to represent your voice at the governor's level. And we are also looking at doing a parent letter as well.
All right, thank you. So board, next on our agenda is the potential letter to the governor. We did discuss this in study session. Actually, that was the majority of our study session. It was decided during that study session that we are going to create a board committee, which will consist of the superintendent, myself, and Hilda. We are going to draft that potential letter to the governor and present that to the board, hopefully for approval at our next board meeting. So there is nothing to report further than that. So the next item on the agenda is the presentation and adoption of the 2021-2022 budget, Resolution 2821. Ginger.
I am recommending that you adopt this budget for 2021, 2022.
And I second. I move that we approve the resolution 2821 regarding the budget.
I'll second.
All right, so Hilda has moved that we adopt we accept and adopt the resolution 2821, and Tasha has seconded. Meg has seconded. I'll get this right. Is there any discussion, board?
I want to thank district admin for putting that together. It further highlighted the prototypical model is still something that, because of that existence, puts budgetary constraints on it. And also moving in, looking at our local control of our levy dollars and how important that is to what a lot of us would say are important aspects of our children's experiences in schools. And so your budget presentation really highlighted those areas, and I want to thank you for that.
I would just like to comment as well. I think I look forward to how we do budgets in the future. I did have questions and I will hold off on those questions, but I do think that as a board, we need to be able to have time to discuss these issues. So, but I will be silent. So any other comments from the board? All right, then I will call the vote. Hilda?
Aye.
Tasha? Aye. Jonathan? Aye. Meg?
Aye.
I also vote aye. The budget resolution 2821 has been approved. Next on the agenda is the WIA co-op with Cleellum Roslyn Girls Swim Team.
I recommend that we adopt this resolution.
I move that we adopt the co-op with Cleellum Roslyn Girls Swim Team.
And I second.
All right. Tasha has moved that we adopt the WIA co-op with Cleellum, and Hilda has seconded. Is there any discussion? Seeing that there is not, I will call the vote. Hilda? Aye. Tasha? Aye. Jonathan? Aye. Meg?
Aye.
I also vote aye. This has been approved and adopted. Last on the administration is classified exempt contracts for the school year.
I recommend that you adopt this classified exempt contracts, that you approve them.
I move that we adopt these classified exempt contracts.
I'll second.
All right, Hilda has moved that we adopt the classified exempt contracts for the school year, and Tasha has seconded. Is there any discussion? Seeing that there is not, I'll call the vote. Hilda?
Aye.
Tasha?
Aye.
Jonathan? Aye. Meg?
Aye.
Gotcha, Meg. Thank you. And I also vote aye. Classified exempt contracts for the school year has been approved. So that will lead us into policy. We have 3 policies tonight. The first policy is policy 5515, workforce secondary traumatic stress. Ginger, would you?
Yes, this is the policy that we talked about last board meeting, and it is a way to include really looking at and giving support to any kind of secondary traumatic stress for our employees, and we are including that as part of our multi-tiered system of support, a system that we already have in place, so that if an employee needs individual care, we know how to help them access that, as well as group care, and really, I think, being intentional around increasing like healthy habits and just overall wellness for staff as well as students. That's the essence of this policy.
Okay. Thank you, Ginger.
I move that we adopt policy 5515.
I'll second.
All right, thank you. I have a motion from Hilda that we approve policy 5515, and Tasha has seconded. Is there any discussion? Seeing that there is none, I will call the vote. Hilda?
Aye.
Tasha?
Aye.
Jonathan?
Aye.
And Meg? I saw you say Meg. I saw you said it, but yes, okay. That was an aye, and I also vote aye. All right, policy 5515 approved. Next policy, policy 1822, training and development for board members.
Yes, this is just really outlines the necessary training for board members and just a recommendation to adopt it.
I move that we adopt policy 1822.
A second.
All right, thank you, Meg. So Hilda has moved that we approve policy 1822, and Meg has seconded. Is there any discussion? Seeing that there is none, I'll call the vote. Hilda?
Aye.
Tasha?
Aye.
Jonathan?
Aye.
Meg?
Aye.
I also vote aye. Policy 1822 has been approved. Last policy for tonight is the ESD equity policy, which we discussed this as well in the study session. And we have decided that after further review, we are going to have a little more looked at it, so that way we can approach this next board meeting. So that was tabled. Oh, so we do need to, okay, thank you. Thank you for that clarification, Matt. I entertain a motion to table the ESD equity policy.
I second.
Oh, I move
Oh, I moved
that we table. You do that second.
Yeah.
I move that we table ESD equity policy.
I second.
All right, thank you. Tasha has moved that we table the ESD equity policy, and Jonathan has seconded. Board, is there any discussion? All right, then I will call the vote. Hilda?
Aye.
Tasha?
Aye.
Jonathan?
Aye.
Meg?
Aye.
I also vote aye. ESD equity policy has been tabled. That leads us to board reports. So Hilda, you are up first. Do you have a report for the early learning?
No, not today.
All right, thank you. Next up, we have teaching and learning. Tasha?
No
And
report.
Tasha has no report as well. How about legislative report? Meg?
No report tonight.
All right, so that leaves me with as board chair, and I do have a very quick report. Sorry, I am so not good with just one screen, so it takes me a while to get to the right document. So we had approximately 25 individual emails, sorry, let me start over. We have had approximately 25 individuals email us since our last meeting in regards to health and safety requirements and mandates from the governor. As board chair, I responded to all those emails and respond to other inquiries using language I understand the board would support. So for transparency, I typically stated, and I'll quote, "The board thanks you for sharing your comments with us. We value input from our community, and your comments will be considered for future board discussion and decision making." These particular emails also, I would typically add, it has been, quote, it has been a challenging year and a half for COVID-19 and all the mandates. This academic year looks to be another year of challenges, but together we will get through it, end of quote. So board, as we receive these, we all do receive these emails. We read these emails and we take these comments into consideration. Board members shall and community members may request for items to be placed on the agenda. The agenda is set during an agenda setting meeting with the superintendent, the board chair, and then the rotating board member. Board, that is my report. Any questions, comments about this process or how I'm communicating for the board? All right, then that's my report. Next on the agenda, we have, we are not doing, we have down community input, but we did our public comment earlier. So now new business. Sorry, I can't take comment from you can. I highly encourage you if you have comments for the board. As I stated earlier, the board will get, every board member will get this email. So if you email board at esd401.org.
I'm curious to just take a comment.
So let me explain. So we did in study session, we did discuss this and we asked to move our public comment to specifically, we really knew that we wanted to hear from the community. So we moved that up so that way not everyone would have to stay for the entire meeting. So we kind of talked that through. So that's what it'd be. We do encourage you to encourage anyone who wants to do the public comment to continue to send us the emails. We will continue to have public comment at our board meetings. So thank you for that. So we are at proposed items for future consideration. I do think that we had some of those. So board, what do we have?
I have an item to consider, Chair. I appreciate all the work that you do in responding to the emails that we receive. We do all read those and take them into consideration. I am wondering if it would help our community to understand the process a bit better if we can formally enter those at the beginning of a public comment period, just to make everyone aware that yes, we did see them, we do acknowledge them, they are here as public comment, even if we don't individually respond to them. Maybe it will be a chance for people to feel more heard.
Thank you, Tasha. So noted. So thank you. Other proposed items for future consideration.
We noted that's been asked for to have Alexandra Sofield to do a presentation on our nutrition program, and she will be set for that. We actually had it set for this meeting, but there was so much on it, we moved it to the 11th. Great. Anything else? All right, then board, that takes us to the meeting closing. There is no executive session tonight, correct? Board, is there anything for board calendar?
Just as a reminder that we have in November, in Boston, taking place.
Excellent. Thank you, Matt. Anything for clarification and next steps? Okay. Signing of documents. I know I have some documents I still have to continue to sign probably before I even go home. Any other comments about signing of documents? No? Okay. All right. Yeah, and again, board members, let's continue to make sure we are keeping up on the signing of official documents. And so that would take us to adjournment. I would entertain a motion. I know you don't want to leave.
I move that we adjourn this meeting.
I second.
All right, Tasha has moved that we adjourn the meeting and Jonathan has seconded. And with that, we are now adjourned. Thank you very much.
Thank you.
Okay.